Hello, everyone, and welcome to our segment for hashtag high school to success. Okay, so we've had several other segments touching on different topics, and today it's going to be about nursing. So if you've just left school and or you've left school some time already and still wondering what to do, this will be your opportunity to find out more about what it is to be a nurse, supporting nations as a nurse, as our title for today is given. So, with me this in this segment is a really amazing, wonderful person who has her bio itself speaks loud about what you can achieve as a nurse or in this field of nursing. So let me introduce you to Ms. Zainoria Zakaria, who's here with me. Good morning, Ms.
Good
Zainoria.
morning. Good morning.
Yes.
Nice to
So,
see you.
nice to see you too. And thank you for being with me today in this segment on supporting nations as a nurse. Hashtag high school to success. Yeah. Let me just introduce you to the audience. Ms. Zainoria is the head of clinical posting and coordinator of postgraduate nursing at Masa University's School of Nursing. Among her qualifications as a registered nurse, registered midwife, public health nurse from UK, and occupational health nurse from the Royal College of Nursing UK, Ms. Zainoria holds a Master of Science in Healthcare Management from Swansea and a postgraduate diploma in counseling from University Kebangsaan Malaysia. She was the former Deputy Director of Nursing, Ministry of Health Malaysia, and Secretary of Nursing Board Malaysia. She was active in the ASEAN Joint Coordinating Committee for Nursing and Midwifery during her tenure, and more recently was a member of the task force for the training of nurses for the Ebola in Uganda. All right. Her leadership and nursing experiences has made her a household name in the nursing fraternity locally and internationally. At the home front, for her contributions and dedications to nursing and social work, among her many awards, she was bestowed the Eminent Nurse Award for Community Health, Tokoh Jururawat, yeah, by the Malaysian Nurses Association, as well as other state and national awards for her services to the country. Internationally, she is a fellow of the Global Nursing Leadership Institute and International Council of Nurses in Geneva, Switzerland, and also a member of Stigma Theta Tau. I hope I pronounced that right. International Honor Society of Nursing. Okay, I tell you, Ms. Ainoria, when I read your bio, I was like, I don't think there's anyone else I want to have this morning to talk with me about, serving nations as a nurse. I mean, you are an, a perfect testament to how nursing is not just about day and night shifts, in the hospital.
Right.
It's just so much, and you've achieved so much. So, you know, and the years of teaching that you've had, the number of nurses that you've inspired and brought out right into the global scene. I want to ask you my first question this morning. Okay, how would you know that nursing is for you? I mean, like in your case, how did you know this was the field for you?
Oh, okay. Thank you, Jennifer. You have given me a question that I myself didn't know that I'll turn out to be a nurse until today.
I
uh,
realized after I asked that question because of what you shared with me the other day.
all right. So along the line, you see, how you want to become a nurse and all those kind of things is actually maybe one thing is whatever comes to you, you grab. No, that was me earlier on in my younger days. So if I share with you what I would like to be, what make you a nurse first and foremost would be uh, you see yourself. You see yourself. What do you have in you? What is your character like? So if I look at myself, I say, oh, I don't think I'm cut out to be a nurse, but in the end, I am a nurse. So the caring attitude, the caring, because to me, maybe because I'm the eldest in the family. I'm the eldest in the family, so you have to be responsible, and then you have to show the quality of that you care for the rest of your siblings. So maybe the first thing that I should say would be the caring attitude that I need to have. To be able to care for people is not easy. Like you say, nursing is not just bedside, not taking care of taking the temperature and feeding the patient and all that. Is more than that. So the caring attitude of you like to care for people, you like to be with people. That is very important because you will see all kinds of patient, all kinds of whatever diseases that they have. Then you have to be able to know, am I cut out to be that? So I think I have that in me. It's just a natural inborn in me because like caring, loving, caring, that's me. That's what I feel that is very important in nursing. And then the other thing is you need to be able to one thing, if you see the nurses in the hospital, they walk a lot. They walk a lot. So you need to have the stamina, the
Stamina.
stamina and the energy because, you'd be surprised that in a day, in a shift, you walk about 4 to 5 miles without knowing it. So you see, most of the time when I walk with my friends or family, I leave them very far behind. But to me, it's just a normal pace because that is how it should be. And
Yeah.
following that, I would say you have to be a person who's very careful with details. So you pay attention to details because that's very important in taking care of somebody. Because you don't have long to save a patient, you don't have like 3 hours or so. Within the 3 minutes, you need to do something if your patient gets into trouble or whatever. So that is one. That comes then the time management. What I mean is the time management, how you go about doing things, and it has to be, you know, everything should be in place. So this is one thing that I learned in nursing. I have to be on time. My time management has to be good. I have to be caring to people. Empathy. I have to be empathetic. I need to feel what people feel. Otherwise, I will not be able to understand why the person is in pain. All right.
Yes. True.
Hold on. I think my battery is out. Yeah? Oh my! Of all time.
Okay,
Hold on.
it's
Hold on.
okay. It's okay. We will just wait for you to plug it in.
Okay. The thing is, I didn't switch on. All right, I'm okay now.
Okay.
So these are among the things that I feel that we need to have as a nurse. So being meticulous in how you
Yeah.
report things and all that. These are some of the things that I feel I have in me. That's why I just accept to be a nurse. And along the line,
True.
there are a lot of opportunities. No, so these are the characters that you want to help, and then you are very particular about details. You look at quality, and you're empathetic, and time management is very important. And you need to be energetic. So that's why I said the first meal of the nurse in the day, it may be the
Yes.
only meal that you can have for the day until you go so that is the thing.
So
So you have
breakfast
to be
is a
healthy.
must.
That's the one.
Yeah.
So maybe that's what I can tell you for now. Some of
Okay.
the things that I think I knew that I have that I can help people. So the characteristics that I have in me, inborn in me, being
Yeah.
responsible and all those kinds. So that's it, Jennifer.
I get that's true. I mean, if we were to look back in generations, back during your time, you grab whatever comes your way, right? I may be quite many years a junior to you, but even for my generation at that point, we grabbed whatever came our way. But for the younger generation these days, I think the thought of having to wipe someone's wound or
Mm,
help someone off the bed is very tiresome. And although there are just a few people within this new generation that still admires this profession, I think are we facing a shortage in nursing, Ms. Zainoria? I mean, statistically, is the world facing a shortage in nursing, in
right.
nurses?
that word shortage of nurses, it depends on how you want to define it, you know.
Huh.
Every day there's some, not only in the nursing profession, in all professions you will see that, you will say you will have a shortage. So you have to look back, what is the shortage all about, you know?
Mhm.
uh, Maybe to me early on I would say because of a maldistribution of nurses, where you put them and what are their qualifications, their specialization. And there are places where you have bosses, all right, for example, that likes you. Say for example orthopedics, yeah, you are a trained orthopedic nurse, right? So rightfully you should be in an orthopedic ward where you can actually contribute to whatever that you have learned or you know. But then your boss, you are in a ward different from orthopedic ward. So maybe you are in a surgical ward or in a clinic or something like that. But because the boss loves you so much and you are very good, he doesn't want to allow you to go out of that unit. So this is maybe one of it. Then the global shortage, again, if you talk, it will not finish in this session. It is going on and on. Nurses,
Okay.
we got a lot of avenues now. It is only like you say, it's not at the bedside. You got a lot of opportunities outside, compared to our time when it's either hospital or you go to the public health or primary health. But again, you will have to serve the population, right? So depending on some nurses, that is why I say you need to plan ahead how you want to move on to your career. Now, how do you want to reach whatever that you want? So there should be a short term, a mid term, or long term planning. What are your goals that you want in nursing? That's why I think I can last until now. So these are the things that global shortage, maybe because people say it's a COVID and the strain and the stress that you go through, and you don't see your family, you work long hours, and because of that, in areas there may be shortage, people come and go, you cannot retain people,
Yeah.
retention rate and attrition rate is because of retirement, old age, yeah, and
Mhm.
people go for greener pastures, so they feel that with nursing as a background it's not enough for them, they move on.
Yeah.
So these are things that's happening around the world, but then we have to look into it much deeper to see exactly what is it. So in the ICN also they have strategies for how to retain nurses. It doesn't mean that once the nurse is at age to retire, that's it, you stop her for the full stop, but you must see the richness of experience that she has that will help in the nursing fraternity. No book can actually tell you what you want to do through your experience. That is why I feel Masa is rich in the nursing lecturers with experience. They have got experience. So they teach the students from the heart. It's not from the textbook. You can open to any textbook and get a theory part of it, but you cannot give them the experience, no? What you went through, how do you relate to them? So these are the things that's very important in nursing. So I think Masa is fortunate enough to have all this kind of nursing, this category of nursing lecturers with us now. Yeah. So this is what I feel. Yeah. I'm talking from my heart, Jennifer.
I know. That's why it's so nice to listen to you.
Oh.
I mean, that's what I want, not a textbook session. You
Mhm.
know?
So that's
So
it.
it's, yeah, I mean, it's good to know that, actually, like I said earlier when I started, your bio itself is, is a proof that you've got so many different areas that you can tap within this field. People hear the word
Mm.
nursing, they automatically think about the the meticulous work that they have to do, the discipline that they need to have. Then they wonder about, oh, how am I going to raise my kids? I think that is the biggest
Mm.
concern when it comes to nursing. How am
Correct.
I going to raise my kids if I have to work shift? The
Mm.
support system that you need to have in this field, in this career, being even for doctors,
Correct. Uh-huh.
the number of hours you have to put in into the place that you work. But like you said earlier, it's not just hospitals these days. We've got different avenues that
Right.
require nurses,
Right.
and you can find an avenue that fits your criteria, your personal
Mm.
criteria, especially when you have kids and other professional enhancements that you want to do, like furthering your studies and stuff like that,
Mhm.
right? One. So yeah. So if let's say I were to let's say a candidate just finishes SPM and wants to go into nursing. Okay,
Right.
um, what should they do? I mean, with an SPM, I know your pathway is into a diploma, right? With an
Correct.
STPM, you can go straight into degree,
Mm-hmm.
right? Or with an SPM into foundation and then a degree in nursing. But what's the difference between a diploma in nursing and a degree in nursing? Would you
All right.
tell us? Yeah,
um, Say if you're a SPM holder, definitely for you to come into nursing, the entry qualification is also quite stringent in the sense that you need to have 5 credits in the SPM, which is equivalent to the O level. If it's in Malaysia, it's a CJ Pelajaran Malaysia. So what you need to have mandatory will be your mathematics, your science, right? You need to have credit in the other one will be what do you call it? Now you put me in a okay, all the sciences and then all mathematics, and then you need to have credit. You need to have a pass in English, and then Bahasa Malaysia, and how many credit? Another 1 or 2 more credits to make it 5. So the
five
compulsory
credits.
one
Yeah.
will be mathematics and science because you deal a lot. So you need to learn about anatomy and physiology. You need to know about pharmacology, calculations, and all that. Without that background, you will not be able to do.
Mm,
So nursing board has put it from, in fact, previously it was 3 credits, but now because we see nursing is so, it is one profession where you say you want to be a professional. So for you to be a professional, then you need to scale up your qualifications and all that. So that will be a 3 years course, full time diploma, and in a degree, besides you having the 5 credits in SPM, then you need to have the equivalent. In Malaysia will be the STPM, the Sijil Tinggi Pelajaran Malaysia, or equivalent will be the A level and then your foundations or whatever that's equivalent to whatever that we have in the regulatory, the nursing board that has put up, because we follow strictly what our regulatory board put
requires.
forth. So it's not easy because nursing is a profession where you deal with human beings. And
Yeah.
then it is one thing that it is not so easy. You have to, because it's a human being. So you need to be careful who comes in, like what we have discussed earlier on. So the qualification part is one thing where you have to really pay attention to it. We do have locals as well as international students. International students, then you will have to look at your English because that's one entry where you need English because our what do you call that? Our program is conducted in
Not in
English
English.
language,
Yeah.
so you need to have that level. For our local students, the English will be the MWET, Malaysian the English. Yeah, so MWET a band of normal 3, and then for IELTS or TOEFL and all that is 5.5 to 6. Yeah? So that is what is being recommended by the regulatory board as well as the Ministry of Higher Education and the Malaysian Qualification Agency. So there are things which the nursing board regulate and things that we have to follow what the country says. So these are the things, this is how we do it. So in the diploma, you can say that our diploma students are also equally good. But then for you to have a bachelor's, that means we will expect you to be able, after 4 years of training and then getting the license here to practice and to sit for the nursing board exam, then only you can qualify to be a registered nurse to work anywhere in the world. Without that, you cannot. Just a university qualification, a pass from university, you will not be recognized as a registered nurse yet. So these are the things. So as a degree student, we would expect your level. Yeah? So in diploma would be 5, level in MQA for degree is 6. So the thinking skills, the critical thinking, analytic thinking. So we need that, the clinical decision making, not to say that in diploma you only follow orders. You have to be a thinking nurse. This is one thing, a thinking nurse. Yeah? So sorry to say you are not just a maiden to the doctor or whatever. So the doctors, they are one profession, medical, and then nursing is another profession. So we know we do the nursing diagnosis, you do the medical diagnosis, and we work as a team. We will be able to do what we want for the patient. That's where we talk about quality nursing care. All right, Jennifer, does
Yeah.
that answer your
Understood.
question?
Yeah. I mean that explains it really well.
Uh,
Uh, Yes, it explains really well. I mean, a lot of people think that, after I finish Form 6, I still have to do a diploma in nursing before I can do a degree because they assume that, I think it is an old
Old thought,
part of school, yeah.
old belief.
Yeah, that a nurse with a degree is meant to become, maybe
Sit
matron
in the
level or
office,
something.
aircon room, and all that. No, you still
Yeah,
have to do basic nursing. We do
yes,
basic nursing, but you diploma and degree, you have to be a thinking nurse. You need
yes,
to know what is next. No, the doctors can give you the orders. Then you have to think whether whatever prescription or whatever that's already charted there is the right thing. So if I don't think, then I will not be able to do it. So
true.
I need to have that. So
Yeah,
that is the thing.
that's true.
Hey,
Okay,
mind you, no, Jennifer, one thing I would like to tell you,
yeah.
for our degree program in Masa, we
Mm,
don't only get fresh from the school. We have those who are already working
yeah.
with other kind of qualification, with a master's we have now currently, they opt to do nursing and they don't mind starting from scratch. So we
Oh,
have a few of them in our nursing school. No?
uh,
They already have masters in some other fields, but I think I need to be a nurse, so they come in and join nursing.
so they are following their passion. I mean, they want to be a nurse
Ah,
somehow, and yeah, I mean,
because
it's
we have not
amazing.
even discussed about what opportunities you have when you are a nurse. So this is the thing that they know what they want, the goals, no, in 5 or 10 years from now. So this is the thing.
True. I mean, okay. What about the exam boards? I mean, or like we have a nursing board, right?
The licensure exam.
Yeah. So if it's an international student who comes and does a Malaysian nursing program, do they have to go back and do another exam in their country?
Okay. Where that is concerned, it depends. If you are here as a student in Malaysia,
Mm-hmm.
then you pass your college or university exam. You have to sit. It's mandatory for you to sit for the nursing board exam for
Malaysian
them to
nursing board.
register you as a registered nurse. So your name will be already registered with Nursing Board Malaysia.
Okay.
It will be there forever until you leave the world lah. So
Okay.
something like that. And then
Until
when you go back
lifelong.
to your country,
Mm.
most of the time they will ask from the nursing board or from the school of the testimonials or whatever that we have to support. And then some countries do, because if you go to UK, you go to Saudi, you go to other countries, they have their own board exam which they may
Yeah.
want you to sit. So that's the thing. For them to register you as a nurse in that country, then you may have to go through
Yeah. So
another
certain
exam.
countries have their own exams that needs to
Yes,
be fulfilled
yes.
as well before they practice.
They call
Okay.
different by different names. So that is
Okay.
the thing.
All right. But that's good lah. That's a good thing to know.
That
Okay.
is that's where the regulatory body plays a very big part.
Yeah. True. Uh, can you share with us the types of specializations in nursing? I mean, if let's
Okay,
say, yeah, if okay, do you get to be? How do you know what is meant for you, and what sort of specializations are available in the field of nursing itself?
all right. In nursing itself, if I can remember, there are more than 26 to 30 kind of specialization depending on what you like. Okay, so if I okay, let me put myself in how I came to where I am. So when I joined nursing, it was the I look at primary healthcare, public health, yeah, public health nursing, which I feel when I compare to the hospital. In hospital, I'm doing secondary prevention where the patient or people I take care are already with an illness and they come in, they get treatment and they go off. So they get cured and they come back for follow up. In public health, in primary health, we look at primary prevention. We prevent before we get even the disease or whatever. Yeah. So I thought that was my passion because I prefer the outdoor life. No, outdoor life, and then I want to mix. I like to mix with people. I see people, population. So the community. This is my passion. I like to be in the community so I can talk to people. No, now that's another qualification or another trait that you should have in nursing.
Yeah.
Interpersonal skills.
Yes.
Interpersonal skills is very important, which I forgot just now.
It's
So
okay.
this is
We'll
where,
touch on it later.
yeah, I set myself okay in year two itself that I want to be in public health. And sometimes the influence from the nurse tutor itself. You look at her, wow, it's nice to be. So you choose where you want. In fact, now if I have students under my care, I will inform them straight away. You come in the diploma. So these are all the specialization in terms of you can go in the hospital pediatrics, you can go to orthopedics, you can go to critical care, renal, neuro. There's so many oncology. You can pick what you want. Some nurses want to be in the anesthetic nurse, so they can operation theater. So if you like to be in where I am, it will be primary health. So primary health will lead you from one to the other.
Mhm.
So there's so many specialization, which I really, for me to tell one by one is a lot. But
So
you have that.
like when a let's say a nursing student, when they get to go for their postings, do they get to try out every specialization during
Okay.
the
Okay,
years
for
of
example,
their?
in Masa, we have quite a number of specialization. So we have the renal, we have critical care, we have peri-op, we have pediatrics, advanced diploma in pediatrics, advanced diploma in midwifery. So this advanced diploma will be the 1 year full-time courses. So we also have the latest is the gerontology and public health,
Mhm.
bachelor's in public health nursing. This is national curriculum which we work with the Ministry of Health that they want only specialized nurses in public health to work in the community. So they've got reasons for that. So because if you are specialized, then you know exactly what you want to do.
What to
Because
do?
in public health, you go by the programs. So we have about 8 or 9 programs now. So that is the thing. So you choose whichever what you like. So to for you to know what you like, then you have to go into nursing. And after your theory, you go into the practice. There's
Yeah.
a theory practice kind of thing in nursing. So
Mm.
when the lecturers give you the theory input, then you would already know when you go to the clinical, you will actually practice what you learn. So as time goes by, you will already know where your
Which
passion
one
is,
you want to pick?
which
Yes.
one you want to be. If you
Yeah.
like children, you go to pediatrics. If you like to talk about neuro, you go and become a neuro nurse. So some of the courses are abroad. So opportunities for you to go abroad to study for
Mm.
that specialization is abundant. So it's knowing where you want to go and how you want to choose what you want the next step in your career. That's the thing I can tell you. So there's so many things.
I mean, it's good that
What
they are given that opportunity to experience it as a student, so that they have the choice to make when they become, a professional.
whatever that
So
they want to choose to go
yeah,
into.
so that means after, let's say, okay, as a you finish your degree in nursing, finish your exam with the
Right?
board of nursing, and then you step into your
The
either
real world.
into the real world. Okay,
Uh,
so when you go, let's say, into the government hospital, you get
all
a
right.
chance to work with the government. Do you also get to select which ward you want, or they will put you where they require a nurse? How does that work?
Most of the time, when you come up from the nursing school, you are a generalist. You are a
Okay,
generalist. That
okay,
means you are a general nurse. They can put you anywhere. No,
all
they
right.
can put you anywhere. But if it's in the government sector, they have got this. In fact, in the private sector also, the hospitals, the nursing board has introduced the mentoring system.
Okay.
So the minute you go in, besides the induction, the orientation, and all that, you will have a mentor. So the mentoring will take about 6 months. So 6 months, and then they will give you reports and all that. Within that time, you will already know exactly what you want. So most of the time, you are in the medical wards, no, in the surgical wards or in pediatrics. Then as time goes on, when you are more experienced in all that, they will actually place you in other places. And sometimes you can choose. You can ask that you want to specialize. Say, for example, you want to specialize in renal nursing. Then you need to have that experience to work in the renal ward for you to be able to go into this renal nursing course,
Okay.
because you need some kind of experience of a
Experience.
number of, yeah, 1 year or whatever.
Mm-hmm.
Or if you like, say for example, renal, but all the time you are in the pediatrics, then you ask to be transferred there to get the feel, to get the experience before you can go into renal nursing as a specialization. That is required. That's
That's good.
how we do it. Huh?
Okay, so the opportunities are there for them to go through all this, because sometimes
Yes.
in certain careers, apart from nursing and medicine and all that, you have to find your way. You have to
Mm.
go, and it's always a trial and error process, and you have to go figure it out. But at least through the nursing education itself, you're given opportunities to discover what is out there,
Yes.
and
Yes.
that's very beneficial to any candidate who comes in to
Mhm.
study in this program. So my last question actually is how do we go abroad? I mean, as a nurse, people, how
This
do you
is
go
one.
abroad? Because a lot of people choose nursing mainly because it's supposed
Money
to be
matters, is
a
it?
career that no, it's not
Huh?
about money actually. It's about experience. It's about having the chance to what do you call that, borderless experience. You want to be able to go anywhere. Nursing is a borderless qualification.
Uh-huh.
Right? Yeah.
Okay,
So
how to go
how do
abroad, all
you
right?
go across the board?
Now, how to go abroad or work elsewhere other than your own country to still as a nurse, all right? So, in fact, how to go abroad as a nurse, like in my I'm still in Malaysia, correct? So
Yes.
going abroad is depending on what you want. So in my career, I've also gone abroad as a nurse, representing our country, our profession, and then doing what you want to do. So if you're talking in terms of working abroad, then firstly you need to be a registered nurse, all right? To be a registered nurse, and then where do you want to go? Most majority of our nurses are in Saudi, in UK, Australia. Lately, they are in the US. Some are in Germany, depending on where you want to go, right? So for you to go over there, then you need to see what is the qualification. As a generalist, to go overseas, sometimes the ticket to go overseas is not like you say is earlier on people go because of the money in Saudi. All right, whatever it is, people will look at your training, the background, where were you trained. So if you say you're from Malaysia, Malaysia is something like when you mention the word Malaysia, it is gives you a higher, you can go a step higher. If you are supposed to be in a dorm, you get a room to yourself, that kind of thing, the
Oh,
privilege.
okay.
So you
All
can
right.
see that our nursing studies here in Malaysia and the training is way
Okay.
above. Maybe because of the colonial days, we had the British here, and then the way that we run our training is more or less UK based and all those kind of thing. That is a plus point.
Okay.
So you have to be registered, you have to be active nurse, and then once you go across to the country like Saudi, Saudi will ask from our side whatever papers or testimonials that you have, and they will also correspond with the nursing board to
Okay.
see how you are personally as a nurse, and then your background. They check. Just a caution to our nurses in Malaysia who want to go abroad. Don't think when you go abroad, we don't know what's happening to you. So they know your profile. So this is the thing that they will lies board to board. So if it
Okay.
meets the requirement, then you go abroad. But then when you are abroad, you will have to also sit for whatever exam that they
You
need you to
require.
sit to register there to work. First and
Mm-hmm.
foremost, you have to be an active nurse with a license to practice. Without that, you cannot work anywhere in the world. So that is one thing. That's how to go abroad. So the papers and all that, that's the
That
usual
is,
immigration
yeah.
and all those kind
Okay.
of things. So you sign contract, you go, you can come back. Most of the time, if you are with the government or in the private sector, they resign. They have to resign and they go over there and they work. So
Mm-hmm.
to me, it is a good, it's a way of expanding your knowledge, gain the knowledge. Is maybe a brain drain from our country, and that side is a brain gain. But then you need to come home, balik kampung. After a few years, you come back because you left your family. So it will be already, brain exchange. That you bring your technology and all that. That's what we have in Masa. Our nurses who went abroad, now they feel that they want to come home, settle down. We tap them, we take them, but they are rich in their experience. So
Yeah.
this is the plus point. If you come to Masa to study, you get all these kind of teachers around. You see, so they just tell you, they know what they are telling you. So textbook is one thing, but the experience again, they are very rich. So these are the kind of nurses that we want to come back, and most of them are already parked in Masa. So this is the thing that even the clinical
Yeah.
instructors, they are the same. So this is
True.
what we do.
Okay.
So
And also we've got a few, I mean, through many years we've been getting 100% pass in the exam, right?
so this is
100%
one thing.
passing rate.
We should salute our nurses, yeah, our
Yes.
lecturers. They are really committed. they drill the students. It can be office hours, it can be after office hours, it can be until 9 or 10 p.m. They will do revision with the students, so they make sure the students know it is not, it's not memorized. You need to know why you put that
Understand
answer,
it. Yeah.
what are the things. So, and then you go to the clinical area, you got very good clinical instructor who tells you exactly what to do. So we always advise our student, when you learn in theory, you do it in practice. So when you are there in the practice area, you will do it correctly. So whatever that you do in the exam, the questions, I can tell you, it is nothing. It is more practical questions. How do you manage? What do you do? And all those kind of things. So if you have done it correctly, 100% passes. That's why I think we get LGM exam 100% passes. They understand, they think, they know what they do, and they have done it correctly, so they can answer. So that's what's happening currently.
That's good. That's really good. So,
Yeah.
we've come to the end of our
Oh,
questions. I have no more questions to ask, but yes, that point earlier that was made about communication skills, and earlier before we came on live, we were talking about being an extrovert and an introvert and an ambivert. Those
Right.
would be the best quality to have. You need to be able to communicate. Right? Empathy is the
Correct.
biggest, most important, hence why nursing is noted as a noble profession,
Mm.
and yeah, I mean, what if I'm an introvert and I can't communicate? Is that going to be a problem for me being a nurse? I mean, speaking
This is
on
the thing
behalf
that
of the public.
when you come to nursing school, we would already have studied you, and then we would have picked you out, and we will actually train you how to talk, because uh, other lecturers do the same, but in my classes I got a lot of presentations. So you like it or not, you have to present in front of me. 10 or 12 to 15 slides is a lot, about 15 minutes. So you need to speak up. So the first round, you may not be good, but the second round, you improve. So being an introvert, then you come in, you talk, you can have the interpersonal skill, the communication, and you have to mix around, because in MASA, there's a lot of programs for students. They have got a lot of, what do you call that? The
Activities.
students activities that you can join, and then you mix with students of other faculties. That's where you build, or you become rich. You start to communicate with people. In nursing, you don't work alone, you have to work in a team. The
Yes.
nurse alone, you cannot do your work. You need the doctors to be there with you all the time, and then you need the physiotherapists, the occupational therapists, the radiologists, the lab people.
Yes.
Maybe you need the healthcare assistant. All work together for the patient. So introvert, whatever it is, will bring you out from the shell, and we will develop you. So at the end of it, so maybe because like in public health nursing, it's not really introvert, but you don't talk much. But when you go into public health, you do public health nursing, they teach you how to talk. So like me now, you have to put a plaster to stop me from talking. So this is the thing that they teach us, in public health and all that. You need to communicate. Health education is very important, health promotion. So you need to talk and talk and talk and convince people. So this is one skill that you learn while you're doing nursing.
Hmm.
So that's
Okay.
what I can say. Can I
So,
tell?
so for
Huh?
those who are listening in, if you think you finding it hard to communicate and all, you just come here. Points I know that will really
Ah,
make you come out of your shell, okay, and be the best version of a
you
nurse.
have to come up from your comfort zone and see what's
Yeah.
happening around you. So this is
Yes.
a thing that we say in nursing. You can do it. You can do nursing. It is not to say that, oh, nursing is not for me. You will not know until you try it.
Yeah.
In fact, opportunities, when you talk about career and all those kind of things, it's not only nursing. You can be entrepreneur. You can be a businesswoman, and then you can go into law. You can be a nurse lawyer, and you look at what's good for nursing. One thing I know is advocacy role. If you like to be in policy and politics, that's where you learn to talk. Why
Mm.
policy? Why politics? Politicking for nursing. That's all. Because politics, I know, is always talking about resources, nothing but
Yes.
resources, isn't it? So
Yeah.
how do you get this? How do you get that? And you like to be an administrator, you go into, you become an administrator or a researcher or whatever. There's a lot of opportunities and
Yeah.
opportunities and fields for you to look around. Start from
Explore.
now.
Yeah, explore and
So that's
be
what,
successful in it, right?
if you like to
Yeah, that's the
travel,
other part.
yeah,
Research,
if
huh?
you like to travel, you can even go into aviation, nursing. You can be onshore, offshore nurse, whatever you like. So it's your
Yeah.
passion. So whatever it is, so that's how it should be.
Okay, that's fantastic. Thank you very much, Ms.
Most
Zainoria,
welcome.
for your time today and for your precious sharing of knowledge. Seriously, it's amazing. And I wish I knew you like 35 years ago.
But it's not too late for you, Jennifer, to join nursing.
I think I'm done
We
now.
welcome you. We welcome you to the fraternity. No problem. No.
It's
With
okay.
your
I'll just work
experience.
alongside with you all. Okay. All right. Thank you so much. And do you have any last words you'd like to say to our school leavers
All
or
right.
those who want
So
to come into
just
nursing?
just to say that thank you very much for today's session, and then this is a sharing, and those of you out there, come join us, join nursing, and we have a lot of things in Masa University for you, that we can share with you, we can teach you, we can groom you to be the nurse that you want to be. So to all out there, good luck to you, and you know where to reach us. So all the best and have a good day today. Thank you.
Okay. Thank you, Miss Ainoria. See you
Most
soon.
welcome.
Bye. Okay, for those who are still with me, I'm going to share a QR code after this so that you can scan it and book an appointment with us to know more about how to embark on this program in nursing and your opportunities, as what Puan Zainoria has already explained just now. And also just to let you know, we have got many types of scholarships that support education journeys. We've got our 100% scholarship for foundation. We've got our blue ribbon scholarship for continuous education support. We've got our latest Madani scholarship that gives you the opportunity to plan lifelong learning, and lots more. And so also do ask about credit transfer opportunities that can give you the chance to shorten your duration of studies for the next program that you pick. And you know what? Scan this QR code and contact any of our counselors, book an appointment, and feel free to ask any questions you want. In fact, you can drop your questions into our comment box right now, and our counselors will get to you. Okay? And if you have anything else you want to know, feel free to just walk into any of our campus. Our main campus is here in Bandar Sarjana Putra, and visit our website to get the addresses. And now I'm going to share with you the QR code, so scan it, okay? Just hang in there. Yes. Okay, so you got that? And if you didn't, you can always rewind because this recording is going to be on our social media page, on our YouTube page. So it's here for you to listen again and understand the beauty and opportunities that are out there for the field of nursing. So, hashtag high school to success. Okay, I got to get this right. Success. Yeah. See you soon.